Hi, good morning, Kinsley. My name is Mihira. Let's start the warm-up session. Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
Your preparation time is over. You can now start your role play.
Good morning, Mihira. My name is Kinsley Carner, and I am one of the nurses taking care of you today. How are you feeling this morning?
Good morning, Kinsley. To be honest, physically I am managing with the pain, but emotionally I am feeling really overwhelmed and anxious. Seeing this stoma bag on my stomach is scary, and thinking about managing it at home makes me panic.
I hear you, Mihira, and it is completely normal to feel overwhelmed after such a big surgery. You have been through a lot over the last 2 days, but please know that we are here to help you every step of the way until you feel comfortable. The main reason for my visit today is to discuss your stoma care with you and run through some essential instructions for your home recovery. I want to make sure we go at your pace. Before we get into the details, what specific concerns or questions do you have on your mind right now?
I am just terrified that I will mess up changing the pouch, or that it will leak and smell terrible in public. I do not even know where to begin when it comes to changing it.
Those are very common worries, Mihira, but I can assure you that with a bit of practice, it will become a routine part of your day. Let me break down the task of changing your stoma appliance so you can see how straightforward it actually is. First, you will gather all your supplies and gently remove the used pouch from top to bottom while supporting your skin. Next, you wash the skin surrounding the stoma gently using plain warm water and a soft wipe. There is no need for harsh soaps or chemicals. After cleaning, it is vital to pat the skin thoroughly dry with a towel, as the fresh adhesive flange will only stick properly to dry skin. Finally, you prepare your new pouch. Ensure the opening matches your stoma size. Peel off the backing and apply the fresh pouch smoothly from the bottom up, pressing firmly around the stoma to secure it. Mihira, to help you master this, I will provide you with printed, step-by-step written guides today, and I will also arrange a practical, hands-on demonstration with our dedicated stoma care nurse before you are discharged, so you can practice under supervision.
That makes the process sound a bit clearer, thank you. But what about the odor and leakage? That is my biggest fear. What if the bag smells or leaks while I am around family or out in public?
I completely understand why you would worry about that, Mihira, but I want to reassure you that modern stoma pouches are engineered specifically to prevent those issues. First, all modern pouches are made from durable, multi-layered, odor-proof materials that trap smells entirely inside the bag. Additionally, they are equipped with integrated active charcoal filters that allow trapped air and gas to escape quietly while neutralizing any odor at the same time. As for leakage, as long as you ensure a correct, snug seal between the flange and your clean, dry skin, the pouch remains completely secure against your body. Leakage only usually happens if the fit is incorrect, which we will make sure you master before heading home.
That is a huge relief to hear about the filters and materials. What about when I go home? How should I be eating and moving around during the initial recovery phase?
For your initial recovery phase at home, your main focus should be on well-balanced meals that help your body heal. Mihira, you should aim to eat a varied diet rich in lean proteins and vegetables, and it is crucial to stay very well hydrated by drinking plenty of water throughout the day. In terms of your routine, you can gradually resume light activities such as short walks around the house, slowly increasing your movement as your energy returns. However, regarding your diet, I strongly stress that you should avoid gas-producing foods initially. Items like beans, onions, cabbage, fizzy drinks, and spicy foods, as these can cause excess wind and make managing your pouch a bit trickier during these first few weeks. You can slowly reintroduce them later on.
Okay, avoid gas-producing foods, eat balanced meals, and drink water. But what happens if I run into trouble or feel confused once I am actually home alone?
You will never be left to manage this completely on your own, Mihira. We have a solid support network set up for you after discharge. We will arrange home visits by district nurses who will drop by your house to check on your stoma and help you with changes. Furthermore, you will have follow-up appointments at our specialized stoma nurse clinic, where we can review your progress in person. We will also provide you with direct emergency contact numbers that you can call at any time if you experience an issue or have a sudden question. Most importantly, to get this support started, I can confirm that I will schedule a meeting for you with the stoma care nurse tomorrow morning so you can begin working together.
Thank you so much, Kinsley. That gives me a lot of peace of mind.
Good to hear, Mihira. Let me summarize our conversation today. We discussed how feeling anxious is completely normal and addressed your main concerns regarding stoma maintenance. We went over the step-by-step process of changing your appliance, which involves washing the surrounding skin with warm water, patting it completely dry, and applying a fresh pouch smoothly. We reassured you that modern appliances use odor-proof materials, charcoal filters, and proper sealing to prevent both smell and leakage. For your home recovery, you will focus on balanced meals, staying hydrated, and light activity while temporarily avoiding gas-producing foods. Finally, you will be fully supported after discharge through home district nurse visits, stoma clinic follow-ups, and emergency contacts, starting with a meeting with your stoma care nurse tomorrow morning. Thank you for your active listening and open communication. I wish you a speedy recovery.